Do you ever think about that? Like, is there going to be some fundamental tipping point here where we understand things that we didn't ever think we could understand, and what those things might be?
Well, I love these conversations. So my father was a particle physicist. And we used to talk about the intersection all the time of physics and biology. Like at some point, as you understand subatomic particles and understand prediction, like at what point could you really understand all cellular function and predict outcomes? The thing that I love about science, and I always try to get kids to think about, is like there's just an endless amount of open questions. And for us to ponder, like there is, like where it's all connected in some way. The world of physics and what my dad was studying, and the search of mass and neutrinos. And again, we just had this memorial, and I was with a couple friends, like talking about the neutrino world, and like they're all over, but they don't interact with any of our cells. They don't interact with the earth. Like they don't like what? But how is that connected?
Yeah. What is the purpose?
What is the purpose, and why is my dad
dark
studying
matter
it his whole life?
What is it doing out there? Yeah.
Right. But I think that there is going to be a world where at some point you will be able to understand the very basics and the foundations of, how the world, the universe really is working, and then how that actually led to all of us. I think that's going to be far off, but I do think that there's a lot of really phenomenal discoveries happening in very basics, whether it's in physics and in chemistry. And then I think also that brings in the whole world of large language models and the ability for you to predict things now, like protein function, and for you to predict, variant resolution. So understanding what a particular mutation is doing, like that's going to be the fascinating world. And I think understanding, the one thing that I always have a huge appreciation for is just how complex the human body is. And so your ability to predict all those different interactions in your body and exactly how that's turned into you is just like such an exciting and interesting problem.
What have we learned in terms of healthcare? Let's get back to this pursuit of hitting 100 years old or 120. We seem to have, in terms of lifespan in the Western world, the things that kill us seem to be self-inflicted. Diabetes, smoking, opioids, suicide. It's almost like where the limitation now has been the surplus and the abundance we have in society in the West is kind of like capped us out at whatever it is, 76 or 77-year-old average lifespan. But you do see people who have access to healthcare and some of these new technologies and maybe some thoughtfulness really starting to live to 90, 100. But also, as Peter, what is his name? Attia sort of talks about health span.
Yeah.
And I think that might be the big unlock, is that like, hey, 80s and 90s, you could actually be like Charlie Munger and doing Q&As with, world's smartest people asking you really challenging questions and be witty and be there, not like be a vegetable. So what have we learned from this, or what have you learned in the company from the last 17, 18 years, 14, 15 million people doing this, that applies most dramatically to health span, lifespan, and just living a better life? Like what's been accomplished here?
Well, I think the first thing that's really almost the lowest hanging fruit is you have certain genetic variants like BRCA mutation or Lynch syndrome, which are sort of well known. So BRCA mutations can make you high risk for breast cancer and a number of other cancers. Lynch syndrome can make you high risk for early colon cancers and other conditions. What always saddens me is that genetic testing, despite being a 20-year-old technology and despite being very affordable, is not a universal part of any healthcare system. And it really should be. And there's all kinds of really important genetic variants that every single person should know about today. So, for example, all your cancer risks. If you have a BRCA mutation, you should know about it because you can be proactive about doing a mastectomy or about screening for cancer. And if you Lynch syndrome, you should be proactive then about colonoscopies. If you're high risk for something called factor V, and that means for blood clotting, you should be proactive about how you are flying and make sure that you're wearing compression stockings or moving around when you're on an airplane. I can go through a whole list of genetic variants that are important for people and their outcomes. And so the easiest thing for right now, when I think about people increasing their health span, is about avoiding preventable deaths.
Mm,
And so
yeah.
right now, there's a lot of people who have a condition where they could really manage it, and they are not getting access to that genetic information through the existing healthcare system. And largely in part because I think it's not part of the reimbursement system. It's not part of the education system, but through 23andMe and through other groups out there, you have access to it. People should get access to it now. And I think you're going to be able to prevent a big number of preventable deaths. I think then you do have a lot of conditions like heart disease, obesity, et cetera, that have an environmental component as well, but there are genetics with that. So understanding the genetic components there, I think it will help people be able to also manage that, manage their lifestyle, understand, for instance, like with all these GLP-1s now, who is it who actually really should be proactive thinking about that before they end up having any other sort of serious health consequences from obesity? Like, how do you actually help use those therapies and get it to people at the right time?
It's super fascinating when I hear you talk about how obvious this is. It reminds me, I don't know if you've ever read about like the introduction of the seatbelt, the shoulder belt and like airbags. Like we had these things so many years earlier than we actually implemented them. And it's like we have people driving around in cars and we could easily put an airbag and a shoulder belt in them and save 100,000 lives a year, whatever it is. Mm-hmm. And, oh, by the way, it costs $99 or $199, whatever it costs. And we're not doing it as a society. Is there any society out there that's, I don't know, smaller, affluent, Nordic country that just said, you know what, everybody in the country is going to have this as a offering for free as part of their universal healthcare? Has anybody made that jump yet? Canada, Norway, I don't know.
I think
Denmark?
that the closest is actually in the UK. The UK has a couple initiatives. They have the UK Biobank, and they have a new initiative called the Our Future Health. And that, UK Biobank has 500,000 people and Our Future Health is 5 million people. And so they talk about returning those results to individuals. The US has an initiative as well to get 1 million people, but they have not returned results yet. I think there's a couple of things. Like, I think one, like the healthcare system is not well set up to fund prevention. And I think a lot of physicians are also not trained on how to use genetic information. So if you think about if I find out that you're higher risk for something, how is it, all those costs, for instance, let's say you're high risk for colon cancer, and I'm going to go and do proactive colonoscopies on you. The way the healthcare system works is they're going to look at what is that cost of preventing versus just treating you once you have the disease.
Okay, I got a funny story to tell you. House of Macadamia has graciously sponsored the All In Summit, and to wow the crowds, they created a special edition salt and vinegar pack of macadamia nuts. And guess what? People went crazy for them. Dozens have been messaging the founder, Brandon, asking him to make the salt and vinegar nuts available on the website. Listen, you've heard me rave about the health benefits of macadamias, but don't take it from me. The most health conscious people in the world are eating them. Dr. Andrew Huberman, I like his podcast. I started listening to it. He mentioned he snacks on macadamias in his GQ profile. And that guy, Brian Johnson, he was on the podcast when he wasn't a health lunatic. He's trying to reverse his aging and he eats macadamias. So all you really need to know, House of Macadamia's products are delicious and they support good health. My favorite, dry roasted chocolate dipped macadamias. I get my chocolate dipped in there. And they also have a dipped snack bar. So I put a couple of those in my backpack. I put a couple of them in my little roller. So I have a healthy and delicious snack. I make a better decision. Listen, if I had a candy bar, which, sometimes I break down and I buy one of those, not a good choice for me. Now I make a better choice. House of Macadamias, they got a new product, macadamia milk. Get a free month's supply of macadamia milk with any order at houseofmacadamias.com/twist. That's a free month supply of macadamia milk with the code TWIST20 at houseofmacadamias.com/twist.